wanted to start off by asking you just what are the latest trends in Harris County with COVID-19 as far as cases, hospitalizations, positivity rate, and what's driving those numbers right now?
So the trends are quite concerning. First, you have to look at hospitalizations, and that's the most concerning one, is the ICU population that's COVID positive is increasing, and that increase is accelerating. And so if that acceleration continues, then we're going to get to where we were in June, July, or worse, to an El Paso type situation. We're also seeing the non-COVID ICU population is quite high, higher than it was at a comparable time before that peak. The general population is lower than it was before our previous peak. But remember, the general population can be shifted around when you have optional procedures that you cancel. The ICU population, on the other hand, nobody is in the ICU for an optional procedure. Now, when you look at the positivity rate, it's lower now than we saw before. It's increasing. We're hitting 9%. And the reason it's lower is also, it's very bad, but it's not 20%. The reason that it's not where it was in June, July is because we're doing a lot more testing. Back then, we were only testing people who had symptoms, and we were only testing people who had absolutely been in touch with someone who'd come back positive for COVID, whereas right now we're opening it to everybody. And then the other indicator is cases. We're seeing around 1,000 cases reported a day in Harris County, and that number is just astronomical. It's enormous. You have to take that one with a grain of salt as well, though, because in June and July, while we were seeing lower cases, we later learned that there was a backlog from the state that we didn't receive until later and wasn't processed until later. And so that's why the number we really need to focus on is the ICU population. That's the one where you can draw a clearer comparison. And what we're seeing is 17% ICU of the ICU population is COVID positive. The COVID positive population is increasing, and the increase is accelerating dangerously. Two more notes, and I'll close with this on the numbers. And we're about to hit a very tragic milestone, which is that we're almost at 2,500 deaths from COVID in Harris County, 2,500 families who've lost somebody to the virus. 1,200 of those deaths took place in the month of June. And so that's why we have to avoid that situation. And we're also about to cross 200,000 COVID positive cases in this county, which is an enormous number, almost difficult to grasp. So we're at a point where we can avoid our hospital systems being overwhelmed, but that's not going to happen without a change in behavior on the part of all our residents.
And what do you believe is driving these current trends that we're seeing right now?
I think it's everything taking together, right now and for the past few months, according to the state, everything pretty much has been open. Restaurants are open, almost 100% capacity. Gatherings can take place of any size so long as they're indoors, which obviously doesn't make sense because we know that the virus spreads more indoors. There's a big loophole for bars to operate. All the schools have been operating. So all of that adds up, and that reopening took place too early and too aggressively for the second time, if not the third time now. So that's the concern. The good news is that we as individuals, members of the community, we can change that. And what I really want folks to remember is that our hospital system is not immune to being overwhelmed, and that a vaccine in the timeline in which it is coming and the extent to which it is coming is not going to keep us from having our hospital systems be overwhelmed if these current trends continue. So right now, it is absolutely in our hands, and with or without state action, we have to make sure that we do our part here in Harris County.
And obviously, cities and counties are limited in what they can enforce because of orders from the state, but are there any additional action steps that you could take at the county level? And if so, what are they, and are you considering them right now?
At the county, I just ordered the relevant departments, the Public Health Department, the Harris Health Department, and our Office of Emergency Management to conduct a review of their contingency measures in the event that our hospital systems are overwhelmed, making sure that we've got the beds in our public hospital system, that we're ready to increase their capacity as we did back in June, July, that we've got the tests, as many as we can have, that our emergency shelter at NRG is ready to stand up within 48, 72 hours. We're not standing it up right now, but we need to make sure that it's ready to get going within the time frame. I'm looking at all options, all other options, but my hands are very much tied from a legal standpoint because of the governor's orders precluding local officials from taking many steps. And so that's why for the past few months, we've all been having to follow that almost absolute opening of everything, which has brought us to where we are. And so really what we need is action from the community in terms of getting tested and avoiding and canceling gatherings with anybody folks don't live with.
That was one thing that public health officials said was a big driver in the numbers recently, was people having these small get-togethers with family and friends, kind of letting their guard down that, you know, may or may not have been at a business, could have been at somebody's home. How do you get through to people? How do you get the message to them that, you know, those can be dangerous too? And are there any signs that that messaging is working?
We all need to adapt. All of us love to eat out, but this is the year where we have to order in. Let's support the restaurants and get takeout. This is not the year to go sit maskless with folks that we don't live with. So it's all a layering effect. You can't blame it only on the gatherings or only on the outings and only on the bars or only on the schools. I mean, everything's been open. And there is a triple threat right now. First is the cold weather. So that's, of course, forcing people indoors where the virus spreads more easily. Second is, it is the holiday season. And so there are going to be more smaller gatherings. And I know a lot of people sacrificed over Thanksgiving, had a Thanksgiving with just their household. And I appreciate that. But a lot of people also didn't do that. And so that may have an impact. And then the third threat, which is concerning, is flu season, is that every year around this time, our non-COVID, or, you know, just generally every year there is no COVID, the ICU population increases because of the flu. And this year we're seeing that increase in the non-COVID ICU population. So that puts an additional strain on our ICUs. And that's why I'm particularly concerned, because we've got this triple threat on top of the numbers we're seeing, which are tracking the numbers we saw before the summer crisis. And that's why things could be just as bad, if not worse, and why I'm asking folks to do their part and making sure that the county is doing its part as well.
You mentioned the emergency shelter at NRG. At what point would you stand that shelter up, and what capacity would that have beyond the hospitals?
Once the ICUs become completely overwhelmed, you need to start taking from the general population beds and turning them into ICU beds. And there's a limit to that. There's a staffing limit. If that increase happens at the same time as elsewhere in the country, there's limited resources, there's limited space, there's limited equipment. But there does come a point at which you don't have enough general population beds for the strokes, the heart attacks, the pregnant women needing to give birth, and you need that additional hospital space. That is when that medical shelter would come. So we're a ways away from that right now, but that is what we're seeing in El Paso, for example, and what we've seen elsewhere in the country as soon as this past few weeks. And so we need to make sure that that's ready to stand up within 48, 72 hours. We can avoid that fate, but we're not immune to that fate. We don't have any special immunity here that El Paso didn't have. We simply have our ability to adjust our behavior and recognize that this isn't going to be a normal holiday season. It's not going to be a normal year. We're at war with a virus, and we have to behave accordingly.
Adam, we got to wrap up if you have one last one.
Okay. One last question for you, Judge. I know that the mayor of Houston, Mayor Turner, has mentioned using a citywide curfew as kind of, I think he called it the nuclear option, right? The option of last resort if things really, really go downhill with COVID. Is a countywide curfew something that's an option for you? And if so, are you considering doing that at any point?
Yeah, look, all options are on the table. And so that's definitely an option that is being considered along with the limited tools that we have. My concern with a curfew is it's a very limited option because it could only be a short-term fix. And the reality with this virus, the reason we've been ping-ponging back and forth and we've seen these continuous crises is because we've had only short-term reactions. And so I'm loath to pretend like a curfew would save us, but certainly if it gets to a point where, you know, we need every single difference we can make, and that's one of the options, we're not gonna not look at it. But there's obviously a lot of challenges with a curfew, and it's not a sustainable solution. The sustainable solution is folks changing their behavior, getting tested, and not gathering with folks they don't live with.
Okay, Judge, I know your time is limited, so we have to wrap up. But as always, thank you so much for making time for us. Really appreciate it.
Thank you. Take care.
All right, you too.